to the discussion for 15 to 20 minutes. And this discussion will be chaired by Prof. Dr. Noor Ibrahim. We would like to have both speakers and Prof. Dr. Noor on the stage. You're invited to ask questions or discuss about the topic that we have just discussed, that is Sarcopenia. And I'm giving the platform to Prof. Dr. Noor.
Thank you, Devinder. So I think it's time for a discussion with our respected speakers. So I would like to open for any questions or comments to both our speakers. Please use the microphones either up there or down here. I would like to remind you, please introduce yourself before you ask your questions. I think we have enough time, I think, for whatever questions you like to ask, and let's hear it from the floor.
Hello, morning. I am Syafarina from University Gubernur Malaysia. Thank you for the interesting presentation. I have a question for Prof. Liang. Now, it's really interesting. I enjoyed listening to it. I noticed that's not much study among cancer survivors, and I'm really interested because knowing the cancer survivors after they completed treatment and with their side effect, and I'm anticipating that their health would be deteriorating, and I'm sure their bone muscle mass and bone mass would be deteriorating. Can you or do you have any additional information that can assist a researcher like me doing in cancer survivors? Thank you very much.
Thank you. Yes, this is a part I did not talk about for this talk, but this is a challenging issue that nowadays after we define how to diagnose sarcopenia, we want to use it in clinical practice. So another challenge is how to diagnose sarcopenia in acute wards. Nowadays, there are several papers. They are publishing showing that sarcopenia is bad for liver cancer, renal cancer, prostate cancer, and others, and other acute conditions. And they're also, yeah, you're right, they are bad for the long-term outcomes, not only for cancer patients, but for all the acute geriatric ward. If the elder patient being admitted for any reason, and they are found having sarcopenia during the hospitalization, they will have poorer outcome. So there are several levels. One is all the acute illness, cancer treatment, and especially if you're receiving some targeted therapy. And then it also related to the tolerance of the subject who can finish all the cancer treatment. It's such like a chemotherapy. Sometimes people can be withdrawn from chemotherapy, but if you're sarcopenic, it's easier to be strong. So if you're stronger, then you can take those things. And one special challenge is the hormone replacement therapy for the prostate cancer. It's androgen deprivation therapy. And that's pretty standard for prostate cancer treatment. But if you're using the androgen deprivation therapy, the patient will have less muscle, which is bad for health. So nowadays, the prostate cancer treatment for androgen deprivation therapy now is become intermittent. So we treat him for some time, the patient is stable, and we don't want them to be sarcopenic or frail. Then we stop it, and we observe the change of PSA. If it remains stable, we're not using it. If it's getting higher, we start using. So use the androgen deprivation therapy intermittently. So that's a current practice guideline. So yes, you're right, you're correct that sarcopenia is also of great implication to clinical treatment. But the challenge is how to diagnose sarcopenia in the acute wards, because most of the patients cannot walk. So no walking speed. So sometimes people use only hand grip strength. But for those who had more severe disease, not able to hold the dynamometer, so that's an issue. So how to measure muscle mass when patient is in acute illness? That's another challenge, because you cannot use BIA because the patient may have a lot of intravenous injections, so there's a lot of fluid to change the body composition. And sometimes some people use CT scan. When you're for the cancer patient, they're doing the abdominal CT scan. They're using the intra-abdominal muscles, not the appendicular. But that's because in the clinical setting it's hard. So that's a new issue. You're raising a very good question. That's a new issue, a new challenge for the sarcopenia research group to deal with in the real clinical practice. Thank you.
Yes,
Hello, I'm Dr. Kartini from the Speech Science Program in UKM. I have two questions, two short questions. Number one, in the research that you mentioned just now, I was wondering, in the Asian group of researchers, did they use animal protein or plant protein? I mean, because as you know, we are much more friendly to the plant proteins, and it's very much available here. And question number two, the recommendation of protein-based drinks that were recommended in the West, it's probably easier there to because they have milk as their daily intake, protein intake anyway. But in the Asian population, how does the group recommend that it be infused in our Asian population? Thank you.
Okay, the first question is also an interesting question. In the systematic review paper we call it PROT-H, they summarized the finding that both animal protein and plant protein can increase muscle mass. However, animal protein can increase the muscle mass faster, more efficiently. However, a paper published by Hong Kong group, so that's from Asia, they found that the vegetable protein work better than animal protein in Chinese people. That's so, I don't know. But theoretically, all from the Western papers and animal protein. So, but at least we know that okay, vegetable protein also work, and maybe better, we don't know, but it also work. And yes, how to recommend older people to take more protein? Yes, in Western country they used to drink milk, so every day you shift your milk to this protein supplement. That's easier. However, in some Japanese study, they work with some company providing the drink, the protein-rich drink. I found that people do accept it, and not necessarily like drink, because some otherwise some relatively healthier elderly, sometimes they will look for some supplements, either tablet or drinks, to improve their health. So I think that's a marketing issue. I think people can accept that, because even in Taiwan, Hong Kong, China, Japan, Korea, I noticed there are a lot of what they call energy drink for the elderly people, and they're selling very well. So I think that's a marketing issue. So in Europe, the first thing they're marketing the idea of sarcopenia, then marketing the product. So I don't know, maybe still people who can put on some protein-rich drink, not necessary to be milk. But I think that's possible, still possible. Thank you.
Any more questions? things are becoming more interesting now. Many areas, a lot of avenues for research, especially on type of food, for example.
I have two questions. First, is there optimum BMI for younger population and older population to reduce the risk of sarcopenia? And what is the recommended or optimum physical activity or exercise to be recommended for the general population?
These are two difficult questions. Okay, for the BMI, optimal BMI for sarcopenia so far is not established yet. We don't know. But for our a paper study from Taiwan, if you look at the overall all-cause mortality for the elderly, so the optimal BMI will range from 18.5 to 35. So you will be either very underweight or very obese. Then body weight will be an issue of mortality. Otherwise, it's protective. So I usually recommend my patients to stay in overweight. Okay, stay in overweight range of BMI. But for the younger population, I have no idea about BMI. But the most important thing, when we talk about sarcopenia, that's more focused on body composition. In Korea and Taiwan, the ladies are very much the same. They look fit in terms of BMI, but their adiposity is very high. So their fat mass is sometimes almost 30%, 30-some percent when they're only 20s. But they have fit BMI. So this, I think, this should move to nowadays should move to pay more attention on body composition instead of BMI only. And the second thing, the exercise. What is the optimal exercise? I don't know, because several papers they publish different programs. But now the principle will be aerobic pulse exercise. And what's the frequency? Twice, 3 times a week. Twice or 3 times a week. How long will it be? Sometimes say 30 minutes, sometimes say 40 minutes. And if you say 30 to 40 and plus some warm up and cool down, it will usually be nearly an hour a day. What kind of exercise is most beneficial? Well, that exercise can be fit into your daily life is most beneficial. So, a lot of time we'll recommend fast walking. Yeah, fast walking. That is the exercise you can take every day. And the walking speed is really related to cultural thing. In Japan, Hong Kong, or Taiwan, people used to walk faster. But in China or somewhere else, they're relatively rural country or there's their lifestyle to walk slowly. It's hard to make them. But in order to keep your muscle mass and strength in your daily activities, without specific exercise program, we always recommend people to walk somewhat faster than you usually do. So that's the exercise that you can do every day is the best exercise. So no, because every program said different thing. So in principle, it's like that.
Right. We have time probably for the last one. One last one. Yeah.
Question for Dr. Noor Syafarina. I just wanted to know, what is your recommendation from your study earlier? You had said that protein supplement is effective. Can you specifically give us a guideline for us to prescribe to elderly individuals?
Okay, thank you, Prof. Syafarina. Actually, for the study, we put cut-off point about 1.5 gram per kilogram per day to actually improve the muscle mass. So we have data from the baseline that stated that the population's intake of protein is actually around 0.9 to 1.0. So based on that baseline, we actually calculated that the amount should be increased until 1.5 gram per kilogram per day. So that's why we're giving up to 20 gram per day for the woman and 40 gram per day for the man to ensure that they reach 1.5 gram per kilogram per day. That was the additional supplementation. Yes. Yeah.
Would you recommend to all elderly? Because they are at risk for sarcopenia. At what age would you recommend? I'm really interested because it seems that the Malaysian population are heading towards 65 and above because of the excellent health status and improved quality of life.
Okay, based on the Prof Liang talk just now, stated that if you giving the protein supplementations, they don't have any effects on the kidney and improve the cardiovascular system. So I would like to recommend this protein supplementation to the elderly, together with the exercise.
Right, so I would like to end this forum with thank you to both speakers, and let us put our hands together for both speakers.